So this idea of a social impact bond is essentially reimagining our lives and social relationships as future debt projections, whether that's being educated, whether that is healthcare, whether that is housing, access or subsidies, food subsidies, being involved in the judicial system. All of these have numbers attached to them. And then they say, well, if we can provide an evidence-based what works intervention, we will pay this much money, which is a smaller amount than we would pay if all these bad things happen to you and we would have to pay a lot more to fix you after the fact. We'll just preemptively fix you. Only the problem is it's essentially pre-crime. Now, the problem is that the terms of these agreements, which are essentially privatizing government services, privatizing services that the government should just be de facto providing, but then the government through austerity says we can't provide it unless we can be assured that it works. And so they outsource it to these nonprofits, some of whom are faith-based nonprofits, to do these social welfare services under conditions of a performance-based contract. The profit isn't in the tiny slice of return on investment. It is actually in the fact that they're going to securitize all the debt and that hedge funds are going to trade off of that debt. The game can't go unless you have the structure. They can't run the bets unless the game goes on. So they have to build the game. And that game is being built right now. They need all of the data to slosh around in a big pool because they can't justify taking profit off the fact that you didn't become addicted if they can't track that against some intervention they put you on in middle school. All of that data has to interlock, and that's what's going to come with digital identity. And that digital identity system is something that the World Wide Web Consortium has been working on for like 15 years. And I had thought it was going to come through education transcript records, but clearly now it seems like the much bigger plan is to have it come through these medical passport protocols.